All right, it's Friday. So today for Fun Fact Friday, my husband's helping out. He's going to be asking some questions that I get from my patients, and I'm going to do my best to answer them.
Well, Dr. Lovell, very nice to see you again. So I got a question. So when you do these tummy tucks and you pull the skin down, so if I have an itch on the bottom part, will it still feel like I'm itching the top part?
So the bottom part is going in the trash after we weigh it. It's going in biohazard waste.
Okay.
But we weigh it, we take a picture, and then it goes in the waste. But if you're asking if the upper part of your abdomen, after we stretch it down, if that feels like it's now, if you're still have an itch in the upper abdomen, even though now it's in the lower abdomen.
Right.
Well, no, because you're numb after a tummy tuck. So a lot of times the skin from mid-abdomen down is like numb after a tummy tuck. It's like craziest thing, patients have said. So that sensation usually recovers over time. Sometimes along the incision line, you still don't have any sensation months or years down the line, but usually most of the sensation in the lower abdomen comes back, and it just takes some time.
Mm-hmm. So how was your day today?
It was great. I had a case, so we did a tummy tuck and liposuction of the waist and the back, and that was a lot of fun. And then I saw some clinic patients as well.
That's great. So when you do these breast implants for augmentation, so once somebody gets an implant placed, are they set for life until they want a different size in the future? How does that work?
So implants are not lifelong devices. So you have to change them out every 10 to 15 years. So, and at that time or anytime in between, you can decide, hey, I want to go bigger or smaller, or, you might want a slight revision or a lift. But it is recommended that you get your implants changed every 10 to 15 years. Why is that? Well, so the implants have really advanced technology. They're like double coated. You can run them over with a car and they don't even like rupture. It's pretty amazing. But it's an FDA based device. So the FDA monitors it and tests it, and they recommend that you change it out every 10 to 15 years before you get like a micro leak or like a little leak in the implant that could cause some capsular contracture and some other complications. So that's why it's not dangerous if the silicone gel, if there's any cut in the actual capsule or if it leaks, but you can get scar tissue around it, which can make your implant look or feel unnatural. So it's more of an aesthetic thing. If you have bad capsular contracture, then that can cause pain, but that's pretty rare. So no, not lifelong devices. You definitely need to change them out every 10 to 15 years. With that said, I have seen patients who come in and have had their implants for 20, 22 years, and they're just fine. And they're like, okay, I just thought it was time for a change. But that's not recommended.
Okay. That's an interesting shirt that you're wearing. Where'd you get that? That's kind of cool.
Oh yeah, so I'm a doctor. Get it? So it's great swag. My co-fellow in plastic surgery.
When you were in training?
When I was in training, she has she opened up her own private practice in Orlando, Florida. She's awesome. But I love this shirt, and that's her. She's the stiletto surgeon. You should check her out as well.
So it looks like she's got a podcast, and she's also pretty active on social media, right?
Oh yeah, for sure. We have a podcast together. I've been featured on her podcast one time, and then we're gonna do another podcast in the near future. So stay tuned for that. But yeah, it's an awesome shirt. I love it. Oh, she also has some stuff on Etsy that part of the proceeds go towards like breast cancer research or advancing women in medicine, some good cause. So go check it out. Stiletto surgeon, Stephanie Porras, Dr. Porras.
Wonderful. Great. Well, it's Friday night, and I think it's time for our date night. So say bye to your patients, future patients, fans, and until next time.
All right. Thanks for your help, babe. All right. You guys have a good weekend. See you next time.